So there's a lot that goes into culturally competent care, and the definition can change a lot. But for me, in my understanding through this class, culturally competent care is an awareness and understanding that as a provider, you're going to have biases and a specific understanding of health that might not match your patients. So this has a ton of different implications and different examples, but this could just be a different understanding of what health means to different people, and or it could mean certain tests or procedures are what you would think would be okay but would not be okay for a patient. So one example of this is like when saying things to a patient, they might have a different meaning than what you think you're saying, or being aware of an attitude that you have towards drawing blood that might be different from the attitude your patient has. And there are many different, another example of culturally competent care is being aware that there's different ways to solve the same problem. So while you might prescribe a certain over-the-counter medication, maybe a person would rather use an herbal medication or something a little more natural. So that's like a general definition of culturally competent care. But I think there's kind of two divisions here because there's competent care within the healthcare system. So if you're like working in a clinic and there's care outside of the healthcare system or like limiting factors that are preventing people from getting into the healthcare system at all. So within a healthcare setting, culturally competent care looks like providing language services and signage that are applicable to the people in your community. That means only running tests when they are necessary. So for the Asian population, that may mean not drawing blood if you don't have to. And for the Hispanic population, that means maybe limiting pelvic exams to only when they're necessary. It also means being cognizant of wait times in the office and other barriers to entry. So if you want to prescribe a medication, but it's very expensive, not everyone's going to be able to pay for the medication, so being aware of that. And then also within the healthcare setting, being aware of social norms like smiling, touching, personal space, eye contact, tone of voice, and family members in the room with them is all ways that you can be aware of culturally competent care. Outside of the healthcare setting, this is just as important though, because there's a lot of barriers to healthcare services. And some examples are insurance prices, social stigma, poor paying jobs. All of these can limit people from even getting the help they deserve or for delaying healthcare until it's absolutely necessary. So being culturally competent may mean having a local healthcare center in each neighborhood that serves that community specifically and takes input from the community. Or that means providing free clinics in low-income areas, different things that would work on preventative care or any care to the uninsured is an example of culturally competent care.